Well, today's discussion is about the kidneys. And previously, when I discussed the systems that kind of worked as like waste filtering systems, kind of like the lymphatic system, we can also look at the kidneys as a very similar system in the sense that there's a large function of removal of waste, blood composition, and regulation. Obviously, homeostasis is a big part of that. Before we dive into it, I like telling stories. Stories are good to kind of emphasize and give meaning to the topic. So, for a long time, my dad has dealt with a heart issue. And it got to a point where he had to get a heart transplant, which he did about little over 4 years ago. But he had a big crash with that heart transplant. He was in the hospital for a long time. And as a consequence of that, it affected his kidneys. And so his kidneys didn't function optimally or normally because of damage to the renal arteries and things like that. So he went on dialysis, right? And so a normal kidney function, you'll have things such as filtering waste products, which is filtering like urea, creatine from the blood, fluid balance, electrolyte balance, which is really important, sodium, potassium, calcium, controlling blood pressure, all those things, erythropoietin, which we talked about with altitude, we'll talk about again. But when the kidneys have kidney failure or damage to the kidneys, dialysis takes over part of it. So my dad went to dialysis for a really long time to help basically had a dialysis machine through hemodialysis. And that blood is pumped out of the body through a machine. And inside the machine essentially functions as an artificial kidney with a semi-permeable membrane. And there's waste and excess fluid from the blood into the dialysis solution. But it doesn't do the complete job of the kidneys, which is why it's just a temporary fix. It's not actually a cure for that. So in saying that, our kidneys are incredibly important. The waste removal, homeostasis aspect is just critically important for how well we live in our lives because our kidneys, if they stopped working just for one day, what do you think would happen? I mean, just think about it. What would happen? I want you to meditate on that a little bit. But think about this with that. What if I told you that your kidneys filter every drop of your blood about 40 times a day? Isn't that crazy? And think about, from learning about the cardiovascular system, how much blood is pumped out of the left ventricle of your heart down to the rest of the parts of the body, then through venous return from oxygenated, deoxygenated blood back. A tremendous amount is happening without your real knowledge. Certainly not your voluntary knowledge. Involuntarily, these things are happening. So we're going to explore the regulation of blood composition, waste removal, and balancing that delicate balance of electrolytes, pH, and fluids with the kidney-based system here. So let's look at the overview. When we look at this overview here, the kidneys filter and regulate blood, okay? So that's the main goal here. Then you have the ureters, which transport urine to the bladder, urinary bladder that stores into your urine until there's an excretion, then urethra conducts urine out of the body. So let's say this again. The kidney filters and regulates blood. The ureters transport urine to the bladder. The bladder is the holding station, okay, urine holding station, and urethra conducts the urine out of the body. So fun fact about our kidneys is that about 1 in 750 people are actually born without both kidneys, and they actually don't even know about it most of the time. And our kidneys are also about the size of a fist, and they receive about 25% of your cardiac output. So again, relaying this back to the cardiovascular system, you know that cardiac output, how much blood in a minute, and the stroke volume, the amount of blood ejected out of the left ventricle of the heart, you're looking at that cardiac output, 25% of it is going to your kidneys. So incredibly high percentage, as our kidneys are incredibly important. Think about it that way as well. So let's look at kind of the anatomy aspect of it. So you have different layers in your kidneys, right? Different layers. And your kidneys are protected by your ribs 11 and 12, but involving layers of the renal cortex, renal medulla, and the renal pelvis, okay? So the cortex, the outer layer, contains most of the nephrons. And you have like 1 million nephrons. Each kidney contains about 1 million nephrons. I mean, that's an insane amount. Your renal medulla is the inner layer with the pyramids that concentrate the urine, and then the pelvis is like the funnel for that. It's that funnel structure that leads to the urine. Think if you could imagine kind of a plastic tubing, a funnel that leads to the ureter for that. So we're just breaking down the anatomical structure here. I mean, if you looked at also the nephrons, which we'll get more into, is that if you stretch those things end to end, it'd be about 100 miles. I mean, think about it in our body. We talked about a lymphatic system that could stretch about 100,000 miles, and all of our blood vessels and all those things, and how many times we go around the earth. Inside of you is literally an entire universe. It feels like the number of stars in the solar system feel like it's nothing compared to what's going on inside of your body and how much. We're not even talking about the brain, which is completely insane when looking at that. Also, when we think about the structure and just some other things about the kidneys on a larger scale, that we basically process about 180 liters of plasma per day, but you only excrete about 1 to 2 liters as urine, which means that about 99% of that's just reabsorbed in your body. So about 180 liters, 1 to 2 liters as urine, 99% as reabsorption when we look at it that way. And more into the nephrons, this is kind of our microscopic filtration plant. So when we talk about urine formation, we're talking about 4 things here, okay? So primarily talking about glomerular filtration, tubular reabsorption, also talking about secretion, and then also water concentration and urine excretion. So let's go over each of those a little bit more. So filtration, this occurs in the renal corpuscle or Bowman's capsule. So this is primarily driven by blood pressure. So filters water, ions, glucose, and waste from blood plasma. So we look at this basically for every minute, the kidney filters about 120 to 125 milliliters of fluid. Your entire blood volume, basically every 4 to 5 minutes, it's filtering. Just think about that. We throw away 4 to 5 minutes all the time. You're talking to someone, you're texting on your phone, you're doing whatever. You're just kind of existing, doing your normal life. And every 4 to 5 minutes, your entire blood volume is being processed on it. It's just mind-blowingly crazy. And even despite this, the red blood cells and proteins, they normally don't cross the filtration barrier unless there is some type of kidney damage. You see this, and we'll talk about this a little bit when you like rhabdomyolysis from very extreme, long-term, intense exercise can cause this big damage to the kidneys, causing this failure there and breaking down past that barrier. So something where exercise can be pretty bad. And what's interesting in this system, there's certainly positives with exercise for the kidneys, but this is a system where exercise doesn't play a gigantic role in terms of optimizing the system, and actually could be very detrimental depending on the type of exercise, the length of it, the intensity as well. Now we talk about tubular reabsorption. This is nutrients and water filtrate back into the bloodstream. So nutrients, water reabsorb back into the bloodstream. This usually takes place in the proximal convoluted tubule and the loop of Henle. And the kidneys decide then what to keep, what to discard. This is a decision-making process. What are we keeping? What are we discarding? So your kidneys are an incredible filtration system. And think about it this way. Your kidneys reabsorb about 400 milligrams of sodium every day. That's literally like 100 tablespoons of sable salt. Think about that. Again, these incredible things that are happening filtration-wise for that. So you also have what is in the loop of Henle, which is a countercurrent multiplier system. This helps you produce that concentrated urine. This is also designed that's used in desert animals like kangaroos, rats, different animals are like that who can survive without drinking water for a really long time for that. Then we have tubular secretion, okay? So this is like additional waste here. It's like hydrogen ions, potassium, different drugs here. These are actively secreted into the filtrate, okay? So this process helps to regulate our blood pH level and toxin levels here, okay? So for instance here, another fun fact, so some drugs like penicillin, these are cleared from the blood so efficiently by secretion that usually doctors in the past had to collect and reuse urine and treat patients with it because it would clear so quickly for that. And so it uses to stretch antibiotics and supplies with that. All right, the last part when we look at formation of urine is urine excretion, also water conservation. So the end product, what you get after all this filtration, the reabsorption, filtration, deciding what to use, processing sodium, potassium, all these different things, here is 95% water, 5% solutes, which would be like urea, uric acid, creatine, electrolytes. And this is where we see the urine color, right? So that urine color and odor provides clues to our hydration and our health. Think about this when we talk about like the skin or the integumentary system. Our skin is our largest organ on our body and is such a great basically litmus test for our overall health that's happening inside of our bodies, right? So we look at things like discoloration, bruising, different things like that tell us a story of what's happening inside our body. Our kidneys do the same thing by looking at visual aid as looking at the color and the smell, right? So we know that a color equals hydration status, right? So pale yellow is more hydrated, right? A darker amber is more dehydrated. We also know when we take like B12 vitamins that you get kind of this weird kind of highlighter yellow type color with B12 here. So if you think about it, your hydration, you can really monitor that through excretion of urine, all right? So pale yellow is more hydrated, darker amber, dehydrated there. Something pretty weird, I'm going to tell you here. This kind of freaks students out, but I think it's interesting to know, is that ancient physicians used to taste urine. Ooh. And they used to do this to diagnose diabetes. So the term mellitus literally means sweet like honey. Diabetes mellitus, sweet like honey, because there really was not a lot of diagnostic function during that time to figure out diabetes. The best way to do it was to taste it. I know you're grossed out right now. I'm kind of grossed out too, but this is the process of how things physicianship worked in the past and how it is to now. Obviously very different, but that was actually a regular practice back then. So a good way of understanding our health and well-being and what's happening inside our bodies is looking at urine color in that last phase of formation, the excretion, water conservation, looking at color for hydration. Pale is hydrated, dark amber is dehydrated. Smell is also another aspect to think about with this. Okay, so let's look at a little bit at hormonal control and kidney intelligence. That's right, kidney intelligence. And really think about all of our systems are highly intelligent, individualized systems that function together in aggregate to form you, the organism that is you. So our kidneys are constantly communicating with the endocrine system, cardiovascular system to fine-tune homeostasis. Remember, homeostasis is essentially a process of bringing us back to our balanced system. When we have negative feedback loops, it brings us back to a system. Think about the thermoregulatory system, bring us back. But we also have positive feedback loops, which push things in one direction for a positive purpose. Childbirth is an example of that there. So these systems, why they are individual systems, they're always communicating with each other so that everything is working in basically synchronicity here. So when we have a lot of hormonal communication. So looking at renin, source is the kidneys. So this function is to initiate, basically raise blood pressure, right? And we have also systems that to decrease blood pressure for that. It's one of the fastest homeostatic feedback mechanisms in the body is renin. We have aldosterone, right? This is in the adrenal cortex. This increases sodium reabsorption, then water follows with that. This helps to prevent dehydration and also maintain your blood pressure. Again, these systems are functioning as kind of a yin and a yang. One does one thing, the other pulls it back another way. If we don't have these systems, we have runaway trains, which ends up causing chronic disease or in extreme cases, death here. Antidiuretic hormone. This is the posterior pituitary gland. This increases water absorption for it. And this alcohol inhibits ADH, or the antidiuretic hormone. This is why alcohol makes you urinate more for that. Then you have erythropoietin, right? This is in the kidneys. This stimulates red blood cell production. Now, this we see red blood cell production increase quite a bit in response to different environments. So, for example, in Colorado, there's plenty of places where there's really high altitude. I think in Gunnison is like the highest level of altitude, 10, 11,000 feet. And living up there would be crazy. I'm in an area where it's about almost 5,000 feet in elevation, which takes something to get used to. But when you're living at altitude, your body produces more erythropoietin to basically secrete more or produce more red blood cells. More red blood cells produce more oxygen carrying capacity to meet the demands for oxygen, and especially with the activities that you'll be doing as well. So erythropoietin is really important. Calcitrol is also there. It's in the kidneys. This is from vitamin D. This promotes calcium absorption from the intestines. So this also explains why kidney failure leads to some bone weakness because of the calcium element to it as well. So another fun fact. I think fun facts are great for learning these type of systems that aren't always so exciting all the time, but gives us a little more juice to it. So kidneys are so sensitive to oxygen, they can even detect tiny droplets of blood oxygen and respond by releasing EPO, right? Maybe you've heard of EPO, right? EPO is the same mechanisms that helps athletes adapt to high altitude training. EPO is also essentially blood doping, right? So you take, instead of just the adjustment you get from altitude, the kidneys creating more red blood cells through erythropoietin, taking blood, storing it, injecting it back into your body is EPO. That's blood doping to try to get more oxygen carrying capacity in your body, especially for endurance-based sports. You probably heard this in cycling, especially the Tour de France. This has been a huge issue for blood doping, and also Olympic-based sports. I find this also as pretty big issue in individualized sports where there's no team element to it, and it depends on your body for the mechanism for promoting winning or propelling you to win there. So that has always been an issue. So let's talk about some other organs in the urinary system. So we have the ureters, which carry urine to the bladder through smooth muscle peristalsis. And kidney stones can get lodged in this area here, so can produce a really intense pain. And this intense pain can either be relieved through passing the kidney stones. I actually had a client not that long ago that had a kidney stone and sent me a text and showed me this disgusting, gigantic rock that literally passed through his urinary system. In extreme cases, this may be relieved through surgery as well here. So this is certainly something that I have not experienced, but I've heard it's incredibly painful for that. But your ureters, they carry the urine to the bladder. Then you have your bladder, which is a muscular organ. And this has the capacity of basically 400 to 600 liters. And it's funny that the urge to urinate starts to begin generally around 200, 300 liters of urine. So everyone can identify with that feeling like you have to go to the bathroom. Well, that doesn't start to about 200, 300 liters. And then all of a sudden, that thing starts to erupt and you really have to go and you start doing the dance. Right? But your brain can override those bladder signals for a little bit until it can't. I'll give you a good example of this. The other day, I was doing some water running, some deep water running, great exercise to do. And always before I do any exercise, I always make sure that I'm emptied out, because one of the things I don't want to do is have to actually go to the bathroom when I'm exercising. But there's also mechanisms in place that inhibit a person from having to go to the bathroom for that. That's why you generally don't have that feeling that you have to go when you're doing exercise, because also what happens is that a lot of the blood is shunted towards your limbs for movement, versus like when you're cold, blood goes rushing towards your heart to protect that vital organ there. But I was water running and I'm about 55 minutes in, and I start getting that sensation, that feeling like I have to go to pee. I have to go. I had certainly hit that 200, 300 milliliters of urine feeling, and I was telling myself, Darian, you don't have to go. You do not have to go. And for about 15 minutes, I was able to override that. Just mentally, I was doing some meditating while I was doing some water running, all that. And then with about 2 minutes left, I was doing 70 minutes of water running. It became unbearable. I did get through that last 2 minutes. I jumped out of the pool. Let me tell you, I didn't run on the pool deck because that's dangerous. You could fall. But I got to the bathroom, and I tell you, I was doing that dance so hard. I looked like a little kid doing the dance, doing the dance. It was like any moment I was not going to be successful. I was successful, but this is an example of your brain can for a little bit override the signal until it is just, you can't do that. Typically, the male bladder is a little bit larger than the female bladder, just primarily due to pelvic anatomical differences there as well. You have the urethra, which is the passage for urine elimination. This also conducts semen in males. And the length is about 4 centimeters for females versus 20 centimeters in males. So the shorter female urethra is one reason urinary tract infections happen much more common in women than it is for men, just because of that. So maybe you knew that, maybe you didn't. All right. So that gives you kind of the larger overfill of what happens in the kidneys. There's a lot going on here. But if you really want to think about it, this whole system is based primarily on being a filtration system, a fluid balance system, and one that is very delicate in terms of understanding what to take in, what to absorb, what to excrete, right? It reminds me just a whole part of the metabolism process. As soon as you start ingesting something, the process of metabolism begins in your body, and your kidneys are a very large part of that metabolizing system. Again, overall, this is a filtration system that happens pretty regularly without your knowing. I mean, imagining all this stuff that's happening inside your body is just incredibly, incredibly impressive and incredibly mind-blowing. The volume of the processing plant, that is your kidneys, to be fist-sized, but to process a tremendous amount of salt, potassium, ions, just different electrolytes in there, urine, creating urine, the formation of urine, excreting that out of your body, taking what's needed, and then getting rid of what's not needed. Looking at the coloration of urine, that also helps with understanding your health and well-being in that particular state. Pretty incredible stuff. I'm always pretty blown away by the human body. Every time I talk about it, I explain it to students, but it's a pretty special system, just like all the systems. Remember, they're always communicating with each other for the purpose of creating homeostasis. Your body wants to be in balance. It's not always in complete balance, but the kidneys, that filtration system, wants you to be in balance. So as I talk about with exercise with this, although this system can actually be damaged quite a bit from exercise, it also can be helped a little bit, can help more sensitivity in the kidney system. But this is a system that is so delicate that with too much exercise, it could really cause some severe issues such as rhabdomyolysis and renal artery damage. And you don't want to spend your time in dialysis. I'll leave you with this. I used to take my dad to dialysis, and he did get a kidney transplant, so he no longer needed that. But I remember when I used to have to take him when I would go visit my parents, and he would be in there for many, many hours every single day. It took up a huge amount of his time, and he really couldn't do anything. So when he got a kidney transplant, it was literally a lifesaver for him because he could resume of his normal life going on with that. So hydrate, treat your body well, and be in awe of the incredible things that your body can do for you.